To understand the vision that I'm seeing for all of healthcare, you have to first break down all healthcare dollars and all healthcare resources and expenditures into two categories: the acute medical illnesses and emergent medical illnesses, things that require hands-on treatment immediately or require very powerful medications immediately. That is one portion of all the dollars that we spend on healthcare per year. And then I want you to split that from another portion, which I'll call the chronic ailments, or anything non-urgent that people can still get to work and live with, but they are just not happy, or they are developing depression based on their ailment, or they are slowly getting chipped away at and weakened by their ailment, but it is non-emergent. When you first break up all of medical care into these two categories, I'll show you how by focusing on one category and completely changing it and leaving the other category completely unchanged or to be refined by ER physicians and those in the fields of trauma, you can completely change all the money that is being wasted in healthcare. For example, the emergency room, the operating room, especially for urgent operations, the ICU, and the hospital is treated as the acute setting. Western medicine has, in many ways, fine-tuned and mastered the acute setting. Emergency room doctors are constantly speeding up their emergency rooms, and directors of hospitals are constantly making their hospitals run more efficiently. This category of medicine, in my opinion, is a success. It's not perfect, but if you look back 50 years, it's quantum levels more refined than it's ever been, and it is inspiring. And directors of emergency rooms and directors of ICUs and directors of hospitals, they should be very proud of themselves for the evolution they have made in the acute setting. And I give incredible praise to them and know that if something very bad happens to me, that system at least has the highest chance of saving my life. That's the acute care setting. A lot of money in our healthcare dollars is spent there, but I feel that's a good expenditure of money. Now over here, we have another huge portion of healthcare dollars being spent on what I call the chronic ailments, or in most cases, the chronic inflammatory ailments. Over here, this is the category that we can really evolve. If you look historically, the past 50 years have not brought incredible evolution in the chronic ailments. If anything, we have more chronic ailments than ever, and people are less healthy than ever. If you look at what's evolving and what's de-evolving in medicine, the acute care is doing great. They're not wasting the government's money. They're not wasting our insurance money. They're not driving our premiums up too much, unless maybe they're making bad decisions using equipment that's too expensive when it's unnecessary. Aside from that, they are doing a great job, and they will keep evolving to do a better job, but it's to be proud of. Over here, in the chronic inflammatory ailments, including acne, rosacea, gastritis, tension headaches, muscle pains, joint pains, hemorrhoids, aches, pains, and everything else that you see on the drugstore shelf to fix your remedy or ailments that you're also seeing the doctor for, this category of what I call the non-emergent chronic inflammatory conditions or non-emergent chronic ailments, this section is not evolving. If anything, this section is de-evolving as businesses are taking over marketing and getting people on the wrong track to fix their wellness. So, here's my solution.